final technique that we're going to try is some self-myofascial release for the psoas. So the psoas attaches the anterior or the front surfaces of the lumbar vertebrae. So we access it through the abdomen. It attaches to the inner thigh, so it crosses the hip flexor, and that's where we're going to start with the tennis balls. So just taking a moment to place your hands on your hips and finding your front two hip points, the parts of the hip that protrude out the most, and then just sinking below that to the hip flexor. If you're having trouble finding it, just lifting the knee, you should feel kind of that tendinous engagement of the muscles. It'll feel pretty ropey through there. And that's where we're going to start with the tennis ball. And so I like to have my right leg out to the side. You can have the leg long as well. And just starting with that straight down compression. If you start to feel any nerve or uncomfortable sensations that feel not quite muscular, then back off, kind of switch where the positioning is. If you're not able to find a positioning that works, then you can just skip this part altogether. Good. And once you find that straight down compression, just try tiniest little movement, shifting of your pelvis side to side. You might go slide up a little bit higher to get a little more towards the psoas and its partner muscle, the iliacus. You'll go a little more towards the inside as it does connect to the inner thigh. It's a little more medial or in towards your center line. And then spending as much time as you feel you need to release here. And then we'll move into more of that abdominal region for the psoas. Now to find it, you're going to start from your belly button and again that front hip point. And then about midway is where you're going to start trying to find the psoas. So placing the tennis ball there, kind of right across from that hip point, starting low. And just kind of getting used to the tennis ball in your abdomen. It's such a sensitive area. A few deep breaths, really using your exhale to soften, release in towards the floor. Good. Once you start to feel comfortable there, to find the muscle, I like to bend that same leg of the psoas that I'm targeting. And then take a little lift of the knee away from the floor. So you're engaging the extensors of your hip, your glutes, lengthening through the psoas, and then release. And usually by lengthening the psoas with the compression of the tennis ball into it, you can kind of feel where that muscle is. And it's acting as kind of a pin and stretch technique, pinning the muscle down and then stretching it up. Good. Now the psoas also laterally rotates the leg, so to create that same idea of a pin and stretch or a pin and movement, you can add some movement side to side, internally and externally rotating your hip. And the psoas is quite a long muscle, and a lot of times different areas or different parts of the muscle aren't quite as reactive as others. So you might not feel like there's too much sensation in this lower part, but as you start to move higher, you might start to feel that tension a little more. Good, so we are going to start to move higher, so you'll start to scoot your hips down so the tennis ball goes a little further up the abdomen. And then the same idea, taking a few breaths, softening in and adding in the movement. I find for me that the psoas, the work here, the movement feels the most effective to release. I also find that psoas work has been the most effective for me with SI joint pain. Just kind of noticing how your body reacts to all of these movements, stretches, strengthening exercises, and it might be different each time. So again, just making your way up, just like we did when we were working through that sacral border, finding the spot, using the same techniques, and then shifting ever so slightly so you're hitting all lengths of that muscle. Good. The place you'll stop is below the rib cage. So before you get towards the diaphragm, kind of where you hit that, right before you hit the ribs is a good place to stop. So just working your way down, up and down, and then switching over to the other side. If you want to follow it up with a psoas stretch, finding a low lunge and really easing into it. So not going into your deepest lunge right away, because the psoas can be quite reactive, and if it overstretches too quickly, it will have the opposite effect of tightening it up. So using the engagement of your glute to lengthen to the front of the hip flexor, so giving that left glute a little squeeze if you're stretching the left hip flexor, and gently easing into it. You can add in a side bend away from the leg. You're trying to stretch to get it more specifically into your psoas. And doing that on both sides, again, just noticing which side feels a little bit tighter, needs more of the work, and spending more time there to find more balance through the body.